So you guys have heard me talk about the junctions before, right? Place my hand at the junction. Basically, it's an area where a bunch of different tissues overlap or interdigitate with each other. So some junctions that I like to work in is in the inferior axilla, because I can either go superiorly right into the inferior aspect, I can go into the lats and the ribs, I can target the triceps a little bit. It's a very versatile spot, right? Same with underneath the shoulder blade here. Underneath the shoulder blade, bottom of the ribs, another semi-junction area. Big junction area, right in this lumbosacral junction. A ton of restriction happens here. After that, we've got here and here. We've got here and here. And then we've got here and here, right? So usually if I'm going to be addressing a chain, I like to compare both sides bilaterally, see where I'm at. And then once I know what chain I'm going to be working on, I like to assess the entirety of the chain to see which section of the chain has the most amount of restriction. For him, it is definitely right in here, all right? And so I'm going to do a little bit of work directly in the tightest area. Why am I targeting the tightest area?
It needs to release.
We need to rebalance, right? So I'm going to take the tightest area, soften it, so hopefully it's as soft as the other stuff, and then we'll continue to just assess to see where the next tightest area is. So neurofascial release. Again, I could just sink in here, wait for 90 to 120 seconds, or Byron, can I get you to take a nice big breath in for me, please? And out. Good, let your hip drop. Good, let yourself fall to the side. Excellent. Those were very subtle movements, but did you guys see them? Okay, again, nice breath in. So I'm tractioning a little bit on the inferior aspect, and then when he breathes out, I'm going to load in. It's basically like I'm trying to bow the fascial chain. Let it go, let it go. Good. So as this contact is sinking into the tissues, this bottom contact is almost tractioning, trying to maintain tension on the tissues. Good. And breath in. And when he breathes out, I load in. Very good. And now, I'm not even going to change my positioning, but I'm going to change my intention. Now I'm going to focus on the fact that his glutes are super, super tight. So instead of focusing everything over here with tractioning here, I'm actually just going to pin down the upper one, and I'm going to do more manipulation of the one underneath my other arm. Nice breath in. And out. Good. Let that fall, let that fall, let that fall. Good. Because even if I were to straighten him out on the table, that would change the feeling of what you guys felt. Right? What you guys felt is he felt elongated on his elongated side, approximated on his approximated side. If I were to drag him over without doing any soft tissue work, then suddenly his approximated side will feel super stretched as I'm trying to pry it out of its position, and his existing elongated side will actually feel nice and slack because I put slack into that chain. Right? So our goal is to try and rebalance as well as rebalance tissues. Okay, so I'll just do a little bit more work here, and then I'm going to move down the chain a little bit, and then I'm going to treat a larger area of the chain. Nice breath in and out. So the great thing about this approach is you don't need to know specific tissues that you're working on. For the purposes of board exam, of course, you have to indicate what tissues you're working on, but for the purpose of you providing effective treatment, you don't need to. Okay, so once that's loosened up a little bit, gonna check to see what's happening here in the glutes a little bit. Yeah, just a little bit in the back here. May I actually work a little bit in your glutes here, Byron?
Yeah, sure.
Awesome, thank you. Consent, right? Nice breath in. And out. Now, you can combine this technique with other techniques as well, too. I utilize other techniques, especially when I'm dealing with the lower chain, because generally those are pretty big muscles. Right, let your knee roll away. Don't hold it. Excellent. Big breath in. And out.
And he's going into the side of his glutes?
Not just going into the side of his glutes, I'm actually trying to roll the chain to keep up the slack. So I'm in his glutes, challenging it, but I'm also trying to coach him to let go. So he's right now very much holding on to this lower aspect here, and that's a very natural response. That's that perceiving threat and danger that the body is. It's thinking, oh no, there's pressure, it's gonna hurt, right? So we can actually ask our patient to disengage that. So watch my arm very closely and see how it starts to move when he lets go. Byron, I'll get you to take a nice big breath in and out. Good. Let your hip roll. Don't hold it. Good. Let go of your stomach. Let go of your hip. Let it fall. in. And out. Good. Let the top of your leg roll in. Don't hold it. There you go. Good. It's not the jutting of my arm as it's slipping across the jeans. It's the very minuscule movement that may be difficult to see at this point. Let it go. Good. That one you might have seen. Good. So once I have targeted a few segments of the chain, there is a way that I'm able to target a larger portion of the chain. I do want an ankle pillow though. Fire your ankles up, please. For comfort. All right. So may I place my hand directly on the skin of your low back here?
Yep.
Awesome. So I'm going to landmark on this very, very fascial area of his low back, right? I'm gonna try and get, you know where the spine meets the hips, there's that little corner that happens right where the spine meets the hip. Yeah. Basically, that's where I'm anchoring into because there's a ton of fascial connections in there. Loading in there. And you could start more proximal if you wanted to, but I usually just go straight for the ankle. Now this is gonna be challenging the entire fascial chain. Good, Byron, I'll get you to take a nice big breath in and out. So with this, I'm right now sinking in with my top hand while maintaining tension with the bottom hand. Let it fall, let it drop, let it drop. Excellent, nice breath in and out. Once that has drifted to a point where I'm content with it for now, I will actually pivot to position myself so that I can focus on the inferior traction of the leg. Byron, let go of the back of your leg. Let it drift away. Excellent. Good, breath in and out. Good, soften your ankle. Very good, let go of your stomach. Perfect. So you guys will notice I'm telling him to let go of areas that are not actually directly a part of the fascial chain that I'm targeting. Reason being is because even though I'm targeting this fascial chain, my hand is at a place that actually intersects with a ton of other fascial chains. Horizontal, vertical, three-dimensional, diagonal, oblique, right? So I can sometimes tell when I'm working down here when somebody is actually holding in their chest and the front of their shoulders. We tell them to drop that. And you can feel it when you're working down here because you're feeling it through the chain. All right, so the idea is that theoretically, if there was absolutely zero restriction in any of the chains, I should be able to just roll him off the table with zero resistance. That means he would be totally let go, right? But the thing is, when you actually go and apply pressure to someone, odds are there's going to be a point where it just stops. Byron, I'll get you to take a nice breath in and out and let it roll. So you can actually see the side of your hip, let it fade. Excellent. Under your arm, let go of your chest. Good. So eventually you'll be able to feel where in the chain the pull stops. Okay, so when I go like this and I go to just try and push him off the table, I can feel that he's stopping right at the base of his neck, holding on, and at his knee. Take a nice big breath in and out. Good, let your knee roll away, let go of your ankle, and suddenly I have more space. Let go of your chest, let go of your shoulder. Excellent. So you can actually feel where along the chain they are holding on. So now that I've gotten this entire side to let go a little bit, I'm gonna get him centered on the table. Make sure the other side is feeling pretty okay. Actually, Byron, I'll get you to move yourself towards the side for me, please. Good. A little bit more in the hips. There we go. Good. All right, now let's see how that's feeling now that we got that tissue released. Still. Now it still feels like it's approximated on this side and elongated on this side. So now that it's not super, super tight because we worked on it, I've changed his angle, and now I'm going to encourage a rebalancing of the tissues in his neutral positioning. Nice breath in and out. So goal was rebalance tissues in their asymmetrical positioning so that everything's all nice and loose and goosey, so you can position them where you want them to be. You position them in as close to neutral as you can, and then have the tissues feel balanced in that neutral position. Does that kind of make sense? It's okay if it doesn't. because we're going to be touching base on this, especially in lower spinal as well too. Nice breath in. And out. Good, let that fall, let that fall. Rolling, rolling, rolling. Don't hold it, drop your chest. Excellent. Good. That should do it. Yeah, there we go. All right, so what we were feeling previously when you guys did your little palpation assessment, elongated on this side and approximated on this side. All right, now, come up and see which side feels like it's what.